How I work with patients is different than some other doctors. I follow the principles of naturopathic medicine. That's a starting point for me. And those principles include, first, do no harm. Now, in many parts of Western modern medicine, it's a balance between using harmful agents that are conditionally harmful, in other words, at a certain dose, a drug that would help you a lot at a lower dose, at a higher dose would be problematic, could cause other problems that you didn't plan on. So a heart medication may affect your digestion. And so there's always a way off with drugs between harm and good. In naturopathic medicine, we want to start by first considering doing no harm. Now, there's always a chance of problems in any kind of medical treatment, but you want to minimize it by using gentler methods to start with. The next principle of naturopathic medicine is the healing power of nature. There are a number of disagreements within the medical community that there is in fact a healing power of nature, but there is. You have a natural ability to heal, to grow, regenerate. Even after surgery, perhaps the surgery removed a burden from your body, damaged tissue or degenerating or diseased tissue, which may be the perfect thing for some people at that time. However, the healing power of nature is the regrowth of tissue around the surgically treated area. There is healing power in every one of us. We need to turn it back on. First recognize it exists, but then turn it on. The next principle is to address the fundamental causes of disease. If someone has a headache, giving headache medication, such as aspirin, may be appropriate, but we also have to look at, why did you get the headache? Is it dehydration? Is it a toxic load? Is it an infection? What is the underlying cause? Let's go for that. Not just symptom relief. Symptom relief is good as a starting point, of course, but you need to think further. I always ask why. I make people crazy. I make myself crazy with asking so many why questions, but that is the critical part of getting to the bottom of any true health issue. Why and where did it start? Because let's look at, of course, first aid, but longer term, what's the true cause of any disease or health problem? Let's solve the real fundamental cause. The next is to treat the whole person through individualized treatment. The one-size-fits-all medical treatment model may be efficient as a business model, but as a treatment process, it's not the best way to go. You need to personalize it for each individual, and that's a tenet of naturopathic medicine. Next is to teach the principles of healthy living and preventative medicine. You need to take charge of your life and take responsibility for what is ultimately going to be your life. You're responsible for your health. Yes, there are doctors. Yes, there are pharmacists, health food store employees. There's many people that can contribute to your health. But in the end, you are responsible for it. You can't abdicate that responsibility. You can't put it on anyone else. You have to know what your choices are. And as a naturopathic doctor, I teach those principles so that people make informed decisions. I may not agree with your decision, but if it's informed and you're making it based on good information, whatever you decide, I'm good with, but I don't want you to make an uninformed decision. Preventative medicine is taking action before you have a problem. The best way to deal with any problem, of course, is to avoid it. So if you have a dehydration issue in your health, making sure that you're drinking enough water ahead of time is always better than trying to pick up the pieces afterwards. If you have a family history of heart disease, taking action earlier in your life to make sure that you solve the problems at least as much as you can ahead of time is always the best way. So I'm different from some doctors because I use these principles and I share information with my patients.